So, Steve, what's EFSA's position on studies that have been conducted outside of Europe?
That's an interesting question, Shawnee, because it forms part of a lot of the clients that we work with, have done studies outside of Europe. There's no mandate from EFSA that says that only studies that have been conducted in Europe can be considered as part of a health claim application. But clearly, the weight that they give to any study will be dependent on, certain key issues, I think. And when we're talking about the geography of the different countries, I think we're really talking about dietary and cultural differences. And so I guess, what are they? People often ask the question about America versus us, or perhaps India versus Europe. And I think if you look at the differences in diets, you can see that protein intake, for instance, might be very different in some countries, poorer countries versus richer countries, processed foods, the Mediterranean diet that we have in some parts of southern Europe. So diet and cultural differences are things that you must address when you're putting those studies together. If you adequately control for those in the way that you submit the data, then there's no reason why EFSA should exclude those studies. But to just assume that they're going to be taken at face value by EFSA would also be wrong. Look at the huge BMI differences that we sometimes see between the North American population and say Southern Europe, for instance. So I think that that's the setting that you have to remember each time.
So let's say we have two studies in Europe at the same site, and then one study completed at a site in India. How do you think those would be reviewed or perceived by EFSA during review?
Okay, so let's make some fundamental assumptions on other issues, because I think if we're going to compare geography, we also need to rule out some other possible influences. So let us assume that every study we're going to talk about has delivered a positive, statistically significant difference in favour of our product, and that there are no other methodological weaknesses in the individual study. So we're just comparing geography. I think the fact that the two studies in Europe were conducted at the same site is an issue. We know that EFSA wants to see reproducible cause and effect that isn't dependent on the research group in which the study's been performed. So they don't want the same investigator in every study. They don't want the same research team in every study. So immediately, the European studies that you mentioned, we have two at the same site. They need some additional support. One study coming from India outside could certainly be included. Could that be influential? Yes, if you address those cultural and dietary issues. But I think overall, I would still see that as a relatively weak package, because the two studies have been conducted at the same site in Europe and rely upon the overseas study. So yes, you can use it, but I think it's relatively weak in that situation.
Another example whereby we have one study conducted in Europe, one in the US, and one in India.
I still think it's not a great package of data, because it's three studies. Three studies has been successful on more than one occasion, but it's towards the sort of lower end of that 3 to 5 study range that often succeeds with EFSA. And the fact that only one of them is in the European population in that scenario isn't ideal. A lot would depend on the comparability of the study performed in India and the US to eliminate those potential differences in dietary lifestyle in terms of diet and exercise, for instance. But again, you have to remember that you've got one study here in your European population, which is a third of your data potentially. So again, I wouldn't say that had a strong chance of success. Using a total package that comes from outside of the European population would be challenging if all the studies were performed outside of Europe. But blending them, if you manage those differences, I don't see as a huge problem.
Okay. So ultimately, it comes back to reproducible cause and effect, controlling for methodological limitations, and being upfront and addressing any of the differences between your sites and your populations included in your dossier.
Yeah, let's be clear, reproducible cause and effect is best proven for an EFSA claim in your target population, which would be, not just for the health benefit, the physiological health benefit, but also for the geography. Regulators are suspicious people, and there would always be that, prove to me that that population is the same as the European population. But there is, as I said at the start, no mandate, no reason why you cannot have a study performed outside of Europe as part of your submission.
Great. Thanks, Steve.